we're going to go over how to initiate heparin protocol on a patient and then how to do second nurse verification for heparin as well. So you're going to start by going to Your Care Compass and you're going to take a look and find your patient. Once you find your patient, you're going to go and look at your tasks. You need to look at your tasks to make sure that you do have heparin protocol ordered. And you're going to scroll down and you're going to find it where it says complete heparin protocol form. You need to know before you click on that task, you do need to know why we've ordered the heparin. Is it for VTE or is it for an acute MI? You also need to have looked at your orders to make sure that you know whether you are supposed to be giving a bolus or not. So you are going to go and look at your orders before you get to this form because you're going to be able to have to answer those questions. So I'm going to go ahead and I'm going to click complete heparin protocol form. This is the first screen that comes up, and it is going to ask you initial or maintenance event. If you're initiating it, obviously it is the initial. If you are changing it because we've gotten assays back, it'll be maintenance. So we are initiating this, so it's initial. It's then going to come up and it's going to ask, is this for unstable angina and MI or is it for VTE? Our order said VTE, so I'm going to go over here and click yes. It also asks, is it with a bolus or without a bolus? That's why you need to have looked to make sure you know whether it is with bolus or not. Our order says with bolus. This screen is basically telling you that I have chosen initial bolus and that I have a continuous dose. Our continuous dose starts at 18 units per kilo per hour. So you need to make sure it's defaulted here. So it's going to tell you we're giving a bolus of 80 units per kilo and I'm starting at 18 units per kilo per hour. Notice nowhere in here does it give us milliliters per hour. We are not doing rate, we are doing dose. So once I've looked at this and validated all of that, I am just going to refresh, and then I'm going to hit my little check mark. Now that I've done that, I can go into my chart. And up here, where you normally have handoff, situation, assessment, recommendation, if you do not already have, notice there's no more tabs up here, but I want to have my heparin flow sheet tab up there. So I'm going to hit the plus sign. I'm going to go down and I'm going to hit heparin protocol timeline. Notice over here it gives me my bolus dose, units, volume, increase, decrease. So because I've just initiated it, I'm refreshing. Now look, we have all of this information, but it's on the right-hand side of the screen. I need to move it all the way to the left, and this is extremely important because when I get my second nurse to come in and verify, I need them to be able to see the numbers next to the writing. So you're just going to go up here, click this little arrow, move it along. All right, so now I have this when my second nurse comes in, and for me, I can tell exactly what I'm supposed to be doing. So I'm going to go ahead and start scanning my meds. So when we're doing heparin, this one is with a bolus. So when you're doing heparin with a bolus, you're going to scan the bag first because you have to have heparin flowing to be able to give a bolus from that. The bolus in heparin protocol at our organization is given via the heparin bag. So you must have a continuous fluid running for you to be able to give a bolus. So first thing I'm going to scan is the bag. Now it's going to give me three choices. The green and bolded, that is what I scanned, and that's what they're thinking I'm going to give. This is the continuous and it's heparin. If you'll see underneath here, this says this is a VTE bolus, unscheduled, which means when my assay changes, if I need to give a bolus, I would click this one. This one is this PRN on call. That, if you'll see right here, it says based on anti-X. So this is based on your assay that comes back. So when your heparin assay comes back and you need to, and your patient is, the assay is too low, you would click this, the PRN part, for it to be able to give your bolus through. Notice though when I do that, whatever is bolded is what I'm supposed to be giving. So What I've scanned and bolded right here is my continuous. So I'm going to say yes, that's what I'm going to start with. I'm going to do my nurse review. Now, once I've scanned it and I said that's what it is, notice my yellow box comes up. So I'm going to click my yellow box. And notice I have a witness here. So I'm going to fill out everything else before my witness comes in. So my site is going to be, we'll say, see. Notice it has rate, but then down here you have 2 empty yellow boxes. So we're going to go, remember, we don't do anything by rate with heparin. So I'm going to go here. But notice right now, I can't see any of my numbers. And this is a problem that you might come up to. So I have to be able to, I'm not going to go by memory. So I'm going to cancel that out. I'm going to have to move this box over so that I can see these numbers. Now click the yellow again. So now when I click here, see it says my heparin. So I'm going to go over here and I'm going to be like, what is my starting dose? My starting dose, initial continuous dose, 18 units per kilo per hour. So I don't have to guess at what I'm doing. I don't even have to memorize anything. I put 18 and it's units per kilo per hour, which is the very bottom one right here. And it automatically filled in my rate. I don't have to touch rate. I just have to touch the dose. My witness is going to be, I'm going to find my friend. Click this. Because we're in train, I have to go to username. You would normally look under last name. Okay, when I do that, notice they have to come in and sign. So at this point, I need to be ready for them to be able to look at my answers and my pump. So I'm going to program my pump. I'm going to say, no, it's not my new patient. I am going to be on med surge. I'm going to go to my drugs. Find my heparin, it's VTE. It asks 2,500 units in 25,000 units. This is 25,000 units in 500. So yes, it's telling you right now, your max dose is 100 kilos, okay? So I'm gonna show you real quick, where do you need to look to make sure that that's correct? So 25,000 units in 500, which is correct. My patient's weight is, now, it depends on what your patient's weight is. It maxes out at 100. So my patient's weight for this is 100 kilos, but it could be 75, it could be 80. If your patient weighs 110 kilos, this weight here should only be 100 because we're doing VTE. The max dose for VTE is 100. The max dose for an MI is 80. So you need to know what your max dosage and why you're hanging this. So weight is 100 kilos. So I'm going to come over here to my pump. My patient's weight is 100. It starts it off at 18. Well, I'm going to come over here and I'm going to look. Is 18 what I want? 18 units per kilo per hour. This is 18 units per kilo per hour. My volume is going to be. All right. So now I'm going to grab my second nurse verification so that they can come in and take a look. Michelle, can I get a second, please?
Of course you can. Okay, so what I'm looking at as a second nurse is I am going to verify that everything that is put in is correct. So I'm going to double check her order, double check the heparin flow sheet, and then I'm going to look at my pump. So I'm looking at 18 units per kilogram per hour, and I'm coming over here and saying, yes, we're at 18 units per kilogram per hour. We've got our bag. It is heparin, 25,500, perfect. I can always double check the rate to make sure it is correct, but like Linda said, we never adjust anything on the mils per hour. So again, 36 matches 36 here, perfect. The only other thing I like to check as a second nurse verification is I go into setup and make sure that this patient weight is not over 100. So I always verify that, because if you're getting a dosing error on there on the pump, that might be what is incorrect on there. So after everything's correct, I would go ahead and say, yes, Linda, looks great. You did a wonderful job. Hit start on that, and then go ahead and sign it in here. Perfect. And now we can, Linda can sign her part if she's all done giving the meds.
So now I'm going to do the bolus. Once again, it shows up yellow, so I'm going to go in and I'm going to click on it. Once again, I'm going to get a witness. You will search by last name. I have to, because we're in the train system, search by username. Take a look. It's telling me, it's already pre-programmed because this is my initial bolus. 8,000 units is what I'm giving. I look over here, bolus dose, 80 units per kilo, bolus units, 8,000. My 8,000 matches my 8,000 there, okay? So I'm going to go, and my site is going to be the same part where my IV is running, and I'm going to hit OK. And then I'm going to, Michelle will still have been hanging out in the room, and she's going to double check now that my bolus is correct. So I need to program my pump. So down here, if you'll notice, it gives me an option for bolus. So I'm going to click bolus. Dose. What is my dose? My dose is 8,000 units. So I'm going to type in 8,000 units. Okay. Once I do that, I can click duration, and it's going to give me an option for rapid bolus. I don't have to program volume to be infused. I just have to hit rapid bolus. But at this point, 8,000 units, I'm at 8,000 units. It's 8,000 units there. So I'm going to get Michelle. Can you double check my order for me, please?
Okay. So just double checking, 8,000 units. Perfect. The bolus dose is 8,000 units. Looks good. Okay. Now I'm going to sign, and we are done. That is how you initiate your heparin protocol.